Hello and welcome back. I hope you got to know each other quite well. And now we are going to the first key speaker. And the first key speaker is Stephen Minton. And he had a really, really long title. So excuse me for not maybe also pronouncing it correctly, but I will try my best. I shortened it a little bit. Stephen Minton, Associate Professor in Applied and Clinical Psychology. And he's going to talk about supportive structures for youth mental health and well-being. And I think maybe he will introduce himself even more in his presentation.
Hello. It's very nice to join everybody today from Exeter, which is in southwest England. I will be talking to you today, and hopefully that's managed to share the screen correctly. Yeah, it's I'm struck by the fact that we should be in Norway. I'm in England, and we're all all over the world. Yeah, how do I say hello to such a large audience? I was in a chat room there with people from Croatia and France, and Germany, and various other places, a lot of people from Norway, and I was just thinking about languages. I made a botched attempt to try and say hello in a few. Part of my work takes me in contact with native people from the North American continent, and in some of those languages there's very interesting way to say hello. It's not simple. It depends on the number of people you're speaking to. It depends on the relatedness between you and your audience. It depends on have you met before. It depends on a whole lot of things. It depends on the gender sometimes of the people you're speaking to. And when you can't be sure what that's all about, there's a way to say hello to a mixed group, certainly Lakota, and it translates as hello my relatives. And I think that's really nice, not just as a general thing, but it reminds us that as human beings, we're all related. And I think that's an important reflection as we're in this isolating period imposed by restrictions due to the coronavirus. So, as Tona says, I work at both Plymouth and in the University of Southeast Norway. So I'm a regular visitor to Norway. Yeah, if I think about what I want to talk about in this half hour, I want to tell you a little bit about me, what we mean by mental health and well-being, and I want to think through these support structures for young people. And to think about how we can be constructive when we come to thinking about our own positions as helpers and where strategic referrals and the possibility of working together might lie. I understand there's some group work to follow after a Q&A session, and I've prepared a few things for people to do there as well, a couple of activities. So, in terms of me, I am, for my sins, a psychologist. I'm not a psychologist, certainly highly critical about what my own discipline can offer and what it sometimes claims to offer. I have a background both in counselling and also in education. So, yeah, today you'll find me working full-time at the University of Plymouth, again in southwest England, and also I have a 20% position at the University of Southeast Norway. I have been a regular visitor to Norway for about the past 20 years, so jeg ønsker å si en spesiell velkomst til folk i Norge, så om jeg skal snakke på engelsk I presentasjonen min I dag. So just say hello to the Norwegian people there. I moved to Plymouth from Ireland, where I'd worked for many years, and I'd worked mostly with schools and school communities. And you can see I've listed, what I'm interested in as a researcher and as a practitioner. And it is really, by and large, in getting into a lot of unpleasant areas. I've worked a lot with bullying and institutional abuse, online aggression. And I'm very interested in how people are included, excluded, sometimes violently so. And interested in what systems surround those processes and what we can do at a very practical level to try and do something about that constructively. So if we go to the next slide, I shall try to do that. So what I'm trying to look at really, first of all, is what we mean by mental health. It's an increasingly used metaphor for a lot of the problems which surround human experience. I suppose, historically speaking, we can... So yeah, over the last probably 500 or 600 years that we're talking in the Western world, I think I spent some time in a chat room just before this talk, and there was an interesting conversation posed by the facilitator there to participants regarding about, do people understand, do people ever give you any bad reactions when you talk about your work in mental health? I think some of this stems from the understandings we had of human experience and the negative aspects of human experience prior to the mental health metaphor. So pre the Renaissance, people used to think of people who were deemed mad or crazy as essentially suffering from sort of some demonic possession or some sort of strange affliction or something like that. And that's, those sorts of ideas still pervade in terms of how stigmatizing it can be to talk about our own vulnerabilities in the context of mental health. I think in terms of destigmatizing those aspects, the mental health metaphor helps us to move some distance, particularly as these days we can talk more about positive attributes of mental health, about mental health as a preventative rather than a treatment practice. I guess where I depart from many of my psychiatric and psychological colleagues is that I do see the limitations of mental health as a metaphor for problematic experience. I think that approaching these things strictly from a situation where a health problem is internal, is biologically rooted within the individual, represented in some postulated brain difference, I think that poses its own problems. Many years ago, there was the name of Thomas Szasz, and Szasz reflected upon his own practice as a psychiatrist and pointed out that 90% of the people who had consulted him, who had been referred to him, were not suffering from any discernible disease, any discernible organic pathology. What they were often suffering from were problems of living, problems in their relationships, things which by and large it wasn't always helpful to talk about in strict terms of health. They needed help, yes, but help could come from other sources outside of psychiatry and psychology, sources such as education, sources such as youth work, sources such as meaningful community living. I think also we have to be very wary of the fact that what is postulated as a mental illness doesn't always make sense that way if we think about how some categories of apparent mental illness can be socially constructed. I think that there's no better example of this than really homosexuality. Up until the late 70s, it was listed internationally as a mental illness. And if you read research papers back then, they will talk about, what's the cause? As if there was a medical cause for one sexual orientation, Some researchers were even heavily invested in developing physical treatments for homosexuality, some of which are still sadly practiced amongst more backwards right-wing practitioners in the United States to this day. Other researchers would look for the genetic cause for homosexuality, which to me always begged the question, well, how's that passed on then? What's quite interesting was that, this was partially dropped in the early 80s. We have a new category appearing of ego-dystonic homosexuality. So if you're disturbed by your own homosexual orientation in the early 80s, then that was a problem. So if you were gay and happy with it, you were fine. If you were gay and unhappy with it, you had a mental health problem. And these days, of course, we see homosexuality entirely dropped, rightly so, from most categories of mental illness diagnoses. Now, what's quite interesting to me is to think about whether this curious passage of how we judge homosexuality as a mental illness or not, does that reflect research into health, or does that reflect changing societal attitudes towards non-heterosexual orientation? It's an interesting question. I think over the last 20 years, as I said here on the slide, we get this focus on wellness and well-being, and mental health being somehow more than the absence of a discernible mental illness. And I think in itself that is destigmatizing. Just to reflect on my own experience somewhat, when I started training as a counselling psychologist in the mid-90s, I did so in Ireland. And there was still a tremendous amount of stigma associated with accessing psychological services. As an overwhelmingly Roman Catholic country, people of a certain generation were more likely to rely on confession and the talk with a priest rather than, maybe accessing more formal mental health services. So there is a stigma, but less of a stigma perhaps than ever before, and certainly amongst younger generations, around saying, well, not all is right with me. So we need to think about these things when we talk meaningfully about mental health, where that metaphor is useful and where it can be somewhat obstructive. So we also need to think about well-being. Um, Now, when we talk about well-being, um, again, we need to be careful that we're not just flipping the problem on its head. Traditional psychology talked about mental illness, and today positive psychology talks about things like flourishing and well-being. Um, and it's one of these things where we do need to take some care if we and and simply flipping the problem on its head doesn't really escape from that positivist individualized assumption that essentially the problems are located within the individual. This has been challenged within psychology over the last 50, 60, 70 years, although perhaps not as much as it should be. There are some of us in psychology who tend to see things more systemically. The humanists from the 1950s emphasised that we need to think about human beings in their social context as they are and as they live, if ever we're going to be helpful and really see fully formed human beings and not human beings just as the sum total of observable behaviours or measurable internal characteristics. Even something like COVID-19 today makes us think about the importance of human beings in context. It occurs to me that globally there are a few organisations who are probably doing quite well out of COVID-19. Our old friends Amazon, who will sell and deliver everything to your door, compliant with social distancing policies, everything you think you need to buy to make you happy. But the other winners out of COVID-19 are Zoom and Microsoft Teams. And although these are handy platforms by which those of us with safe and comfortable middle-class existences can make a fist of doing their work online, they also reflect, I think, that need to connect, that need to find our community. I've not been involved in any Zoom conversation work-wise where we got straight down to business, where there wasn't a check-in with how are you coping, how are you doing. It is that struggle, that need to find community, to find context, to find relationality, and to find connection. And that's where we become and where we are human beings. So as I said, within systemic psychology, there is that understanding. There is that understanding that we are beyond individualized. We are beyond separate entities. We are contextualized people. We are embodied souls. And therefore, in systemic psychology, not only do we look at the social context of things, but we look at the social genesis of things. Some things are not caused internally in our brain chemistry, but are actually represented in the here and now in our relationships. Just a note here I've made is that you'll be hearing this afternoon from Willy Ogre and Camilla Wieg. You'll also be hearing from Paul Solberg, and we four are the nucleus of a research group at the university, and where we look at what does it mean when we talk about transitions in young people, be they teenagers, young adults, and in order to capture what's meant by a transition in life, we need to draw from more than psychology. We need the youth work, we need the sociology, we need the educational theory. We need to shine many, many lights on this in order to be able to appreciate these things fully. So as professionals who by and large want to help young people, and the time I spent in a chat room before that was a common thread for all of us. We might have had different professional trainings, we were in different countries, but throughout the common thread was that helping of the youth, helping with the young adults. If we seek to do that, we need to be quite clear about where these systems of support really are. We need to think about where the limitations in those systems of support might lie. We need to think about where we as practitioners can and can't help, and how we might work constructively with others. So the next slide, I think, is a good reminder of the various sources of support and resource might exist for people. So I'll tell you more about this in a little while, and you will get a chance to play with this somewhat in the group work which follows this presentation. So what we can see here is sort of a pie diagram, which is labelled and which is divided, somewhat arbitrarily. It's not a case of these things are necessarily weighted, but it's an attempt to include everything here. So we see the material resources. And if you work around and you can think about this for yourself, we are all differently advantaged or disadvantaged comparatively in all of these. Some of us have more money in the bank. Some of us feel more satisfaction at work. Quite a lot of us are probably going to be highly educated. And when I say us and think about the people I speak to just now, quite a lot of us are going to be highly educated with postgraduate degrees, but the people we work with might not be. We're all going to vary in our home and family life. Some of us have kids, some of us don't, some of us have parents, some of us don't. Social life, you can see how that is important as well. And what's quite interesting is that that's 3/4 of the circle. If you look at what psychologists, even positive psychologists, will focus themselves on, it's the personal resources. But one of the many things of this diagram, and it's called a power wheel. One reason why that's important is because it reminds us that there are other social attributions, social resources, social contexts, as well as those highly individualized differences in abilities and resource. So in terms of what a youth worker might need to think about, well, when we first meet a young person in trouble, I guess it's a case of trying to understand, trying to weigh up whether we are the right person to help. We need to have a think about what needs are being expressed, what needs might be unexpressed, whether it's a mental health problem, whether it's an educational need. I spent a long time working with teachers in schools and school communities, maybe 20 years of that in Ireland. And many times I came across teachers who would be, shall we say, at their very wits' end, trying to help with young people. By and large, teachers are caring individuals, not excessively motivated by money or anything like that, but motivated by this desire to make a difference for young people. What a teacher's trying to do, of course, is to work as a pedagogue. There's pastoral elements of teaching as well. But, when the needs were perhaps situated elsewhere, but merely coming out in the classroom, the school context, sometimes these children might be in need of psychological support. It may be that the child came from a family where social work support was needed. And a lot of what I did in school communities was to try and get people to play to strengths which exist in the community, strengths which might not always be obvious in the community. Accessing of services which might be mysterious, might be unknown to people, and try and get the right people working together. As I said here, this is the logic of working together as a team. The idea, hopefully, professions can work in that complementary way to serve people more effectively. Of course, practically doesn't always work that smoothly. There's power struggles, there's people failing to understand what the different professions can offer. There's problems in communications between different professions. The referral routes can sometimes be unclear. But if we can try and think about this a little bit broadly, and to recognise that sometimes we can help, sometimes our training, our experience gives us certain advantages, but sometimes there's limitations as well. And not all of us have a magic wand, and sometimes it's not about co-constructing a magic wand, but just seeing how we can work best together to make the difference we'd all hope to make to young people's lives. Just there's a few questions, for reflection and discussion, which I just, before going over to the Q&A session, I'd like just to introduce to you. So this is something to think about in group work. I'd like people to think about the way you individually conceptualize, understand distress and well-being. To maybe think through about, are your understandings primarily biological and medical? Does this maybe affect what you might expect from psychologists and the mental health services? We also have to think about, our sense of normality, abnormality, sickness, wellness, health, despair, and to think about, is that affected by, the moral judgments we might have learned? To what extent do we allow ourselves in this constant discourse regarding mental health and individual aspects of mental health? To what extent, do we always think about context? Is it sometimes easier, perhaps to think about, well, is there a pill for that? Is there somebody who can therapy some sense into somebody? Is there a professional out there who can somehow change somebody through something? Or do we always think about the community and social resources which can be drawn on? Then what I'd be suggesting is that we do have a play with that power wheel diagram. For those who are interested, the references are there. It comes from a British clinical psychologist by the name of David Smale, who left this plane. He passed about 6 years ago, but not before putting together some extremely interesting and challenging to his own profession, some very interesting sets of ideas. One of the really nice things about David Smale is that he embraced, as an older man even, he embraced the possibilities of technology quite early, and he was quite concerned that people would be able to read his ideas, people who wouldn't necessarily have the financial means to buy expensive textbooks. So he made a lot of his key ideas available for free on the internet, and there's a little link to a major set of his ideas, which were called Power, Responsibility and Freedom. What I'd like you to do is maybe to have a play with that power wheel. And this is a little exercise which I do with some of my graduate students in Plymouth, and it's a little exercise I've done in the University of South East Norway with the master's program, which I contribute to there. And essentially it's written here: I'd like you to have a think about that power wheel as it applies to yourself as things stand in this moment. It might be you could mentally colour in the different sections and to think, to what extent are you satisfied with your education, your parental relationship, relationship with your blood relations, your partner, and so on and so forth. And to actually have a look at that, just as things stand now. And you can play this in different ways. You can think about different points in your life. You can think about where you would aspire to, where you are now, the difference between the two. There's different ways of doing it. But what I'd also like you to think about is, a young person who comes to you for help, and to think about how a power wheel might look for them. And what you'll see quite probably is quite a difference in the resources which we can call upon. Very often as professionals, we're relatively advantaged compared to those who come to us for help. And I think that this is quite an important reflection for people to think about. So you might mentally want to put those side by side. And these power wheels are things you can print off, you can do for yourself, you can do with groups as I do in training. But what I'd like you to do is to just really to try and enjoy yourself with that. It might be a nice thing for you to do in the group work session. I'm going to go to Q&A in a bit. I just wanted to say that thank you for listening. My email address is there. If anybody wants to get in touch personally, you're very welcome to. Should you be curious about me in any way, well, the public face of me at least is available via my university URL just there, so you're welcome to look me up. And if you think I can be of any help or share anything useful with you, I'll be very glad to hear from you. If you're ever in Plymouth, when we all get back to work, whenever that is, and well, feel free, if you let me know you come in, I'll even make you a cup of tea. But for now, I'll stop that share and we'll go to the Q&A session. Thank you all very much.